All right, welcome back to another 50th anniversary highlight video. Today we are with case management. Let's go meet the team.
Good morning, everyone. We are with Jillian, the manager of case management. Jillian, tell us a little bit about case management. What does one do in case management?
We do all the things in case management. We work collectively as a multidisciplinary team with every team that is inside the inpatient hospital setting in an effort to streamline discharges and help get our patients to the appropriate level of care that they need post-discharge.
So what does that look like? So if somebody maybe needs like a rehab center after they leave, is that something you all are helping facilitate?
We do. So we coordinate multiple things. We help with transport if they need rehab. We meet with patients, discuss choices, see where they want to go, see what the best fit for them is, but what's also included in their insurance.
So there's a lot to that.
There is.
Many hats.
Many hats.
Roughly how many case managers are on your team?
We have 30 case managers on our team here at St. Thomas West, and I have 2 at our regionals.
Wow. And are those 30 case managers the ones that are here day in, day out, or is there like a second shift?
No, we have roughly 20 case managers a day, 5 PRNs, and 5 case manager assistants.
Okay.
So we have a weekend team that works Friday, Saturday, and Sunday from roughly 6:30 A to 6:30 P.
Okay. Goodness. And roughly how long has case management been a part of the hospital?
It dates back to 1974, so we've had some form of case management since 1974.
That's awesome. That's really cool. And who is your longest standing team member?
Kim Bond, one of our CMAs, has 25 years, and then we have a social worker, Catherine Rankin, who has 23.
That's amazing. That speaks
awesome.
volumes. I love that. Can we meet some of your team today?
Absolutely. I love for you to meet my team. They're phenomenal.
All right, let's go.
All right, so I'm here with a team, and I noticed that some of you are RNs, some of you are social workers, and then we have what was your
I'm one of the
assistants.
I'm actually been an EMT for 10 years.
An EMT for 10 years. So if you all want to tell me a little bit about what your different roles would be.
The case manager role is the same for the social worker and the RN.
Oh,
we
okay.
actually do the same position.
Okay.
Yes, we just have this different licensure.
Oh, interesting.
Yeah. Mm-hmm.
Okay. So what about the assistant?
So the assistant, we obviously assist the case managers with anything they need. We normally do help them with discharges, help them with anything that we can deliver to the rooms. And then we also have our own responsibilities as far as like Medicare outpatient observation notices. We do our discharge summaries and send those out to the facilities when the patient leaves.
Interesting. So you all are mostly in charge of getting people out of here. Is that right? Yeah, you're like with everything that they need to succeed in life outside of the hospital.
Exactly.
As Jillian would like to say, discharge planning starts at the very beginning of hospitalization.
I'm actually in the emergency department, so I see when they are first coming in, and sometimes try to start that discharge planning early, like right when they come in the door in the emergency department. So my role is a little bit different, but I'll start a lot of it as they're going to be admitted, and they can be followed up on the floor with another case manager.
Is there a client or a type of patient that's the most difficult or the most challenging to discharge?
I would say, as far as difficulty, each patient is unique. So each patient has different needs. So there's no real level of difficulty that you can say, hey, this particular patient is more difficult than another.
Okay.
But each one of them have unique needs that are unique to their situation, their living situation, what needs they have when they go home.
Okay.
And I think going back to that, I think depending on somebody's, family situation, like you said, or insurance barriers or their chronic diagnoses as well, I think all of that can play a role in how difficult the discharge plan is going to be.
Okay. Gotcha. And then is there a fun fact about this department that you would like the rest of the hospital to know that maybe, no one knows, something interesting?
Jillian had mentioned before, we have 30 team members in our department and have a combined experience of 212 years between our department.
212 years dedicated to Ascension. Aw, so sweet. Jillian, if you could have a superpower that would help you day to day with your job, what would it be?
It would be teleporting so we can get patients to and from wherever they're going very quickly.
I like that.
And then what would be your favorite thing about your job?
My favorite thing is really just like the relationships we build with like our physicians and our multidisciplinary teams. We don't get as much patient and family time as being directly bedside, but those relationships that we build here at Ascension have been a true blessing to all of us.
That's awesome. Lexi, if case management was a reality TV show, what would it be called? Or what would it be?
It would be Survivor.
I understand that. Day to day, busy. And then what's your favorite thing about your job?
Favorite thing, similar to Jillian, would just be the staff here at the hospital. Everyone is wonderful to work with, and I think a lot of people would say that is what has kept them here for so long, not just in this department, but in other departments as well.
West is best.
Mm-hmm.
Good morning, Valerie.
Morning.
Thanks for being here.
Thank you.
People want to know, if someone is new to case management, what is a word of advice or maybe a gem you can offer to them?
I would like to say to a new case manager to chart every day like you're not going to be here tomorrow, meaning you could possibly be off, whether you know it or not, or out ill, just so the next case manager following you will have clear and concise instruction on where you left out on the patient
That's excellent
to make
advice.
smooth transition of care.
That's really good. I like that. That probably could follow over to probably all of our roles here. Just charting like there's literally no tomorrow.
Right.
I like it. What's your favorite part about your role?
I like the interaction with patients. I like to talk to people, meet new people, help them solve their problems. Yeah, I still like to interact with patients.
I love it. Thank you for your time.
Thank
Thanks
you.
for being here.
All right.
What's a fun fact about case management?
A fun fact about case management is we do more things than you know we do, but we do less than you think we do.
Oh, okay.
How's that?
How long have you worked here?
I've worked here for 10 years and 2 days.
What's your favorite part about your job?
My favorite part about my job is that we get to help people, not just the patients, but the families as well. I think that sometimes the greatest reward is seeing the relief and the comfort that we can give
That
families,
makes
knowing
so
that
much sense.
yeah.
That all the responsibility isn't falling on me for my sick
Sure,
family member.
and we can answer questions for families that maybe the doctors, like the doctors are great at medicine, but then when it comes to some maybe social or challenges as far as disposition of getting patients to the next level of care,
Okay.
the doctors may not be experts at that, but that's something that we do.
That's awesome.
Yeah.
Well, we appreciate your time. Thanks
Sure.
for letting me bug you.
I love it. Absolutely.
All right, y'all. Thanks for joining for another week of our 50th anniversary highlight videos featuring case management. We'll see you next week. Bye.